Stark realities for girls and young women fuel the AIDS epidemic in Southern Africa. Poverty, sexual violence, gender inequality, barriers to education and family planning. In Zambia, more than 1 in 10 young women will be infected with HIV by age 24. To address this crisis and understand the risks young women face, we must engage and empower them, and we must listen to them.
If we don't take this moment to reach out and teach about adolescent girls, HIV and AIDS and sex, we're killing the future generation. We're going to shut the mouths of great leaders who will not have the chance to finish their education because they were not listened to.
I started having sex when I was 15, though I didn't have enough information on sex, on contraceptives, on how to prevent unwanted pregnancies. I would wish that back then, before I got pregnant, I wish I had someone to tell me a lot about sexual reproductive health. The time that mom gave birth, because I was still breastfeeding as well, she gave birth, then after 3 months, then she died. So I was the one taking care of my baby brother. I was breastfeeding my daughter and my baby brother. So life became more tougher than that.
There are a number of reasons for why they are getting pregnant with HIV and AIDS. It's out of desperation due to poverty in the country and in the communities, which leads them to, wanting things from other men.
Girls are being married off at a tender age. So let's say they'll marry you off at 16. In that first year of marriage, they'll expect you to give birth.
The medical personnel, they are judgmental. Most of them are judgmental towards us. Like, for example, if I go to the hospital and say I need to get condoms, what are they for? I mean, you're not married, so what do you need condoms for? Or if I say I want to get tested for an STI, why have you been having sex? They'll judge your behavior instead of giving you the help that you need.
We have many young ladies in this country today that are going through gender-based violence, rape in the homes, and they cannot stand out because no one is hearing them. We need mothers to believe when a girl child is told she has been raped.
What happens when they fall pregnant is that they drop out of school. Most of them are pushed into marriages because the parents cannot afford to take care of that girl as well as her baby.
So you find that the life of the girl will be the dreams of the girl will be just shattered just there and then. I would love the government to understand that they need to help a girl child. We are the most vulnerable to teenage pregnancy, HIV, STIs.
The best thing we can do to protect us and future generations is to make sure that services that will help us live a healthy reproductive life without any stigmatization.
It is important to have the voices of adolescent women and girls because they have the experience. They go through these things. Their friends experience these things. Their sisters, their mothers, their neighbors, and they know what could have been done to avoid it.
I want to go back to school. I want to stand up on my own. I want to become my own ambassador so that I, teach other girls so that they can learn from me.
My dreams are to be able to help particularly the women rise up to positions where they are able to make decisions on their own and be able to live a sexually healthy life.
We need for this pandemic to end here with us. We need to create a healthy generation, educated girls, girls achieving their dreams, young men and women respecting one another, parents who are able to reach out to their children and educate them and encourage them and give them the goals they need to achieve their dreams.